In today's video, we will be discussing the 9 important signs of liver diseases and damage. The liver is one of the most vital organs in our body, playing a huge role in maintaining our overall health. Recognizing these signs early can make a significant difference in getting the appropriate treatment. Let's dive into these signs and what they mean. First, let's take a moment to understand how important the liver is. The liver performs a variety of essential functions, including detoxifying harmful substances, producing bile for digestion, storing nutrients, and managing metabolism. Without a properly functioning liver, our bodies cannot perform these crucial tasks, leading to a range of health issues. 1. Jaundice. The first sign we need to discuss is jaundice. Jaundice is characterized by the yellowing of the whites of the eyes and the skin. This occurs when the liver cannot process bilirubin, a yellow compound that is formed during the breakdown of red blood cells. Normally, the liver processes bilirubin, and it is excreted from the body in bile. However, when the liver isn't functioning properly, bilirubin accumulates, leading to jaundice. This is often one of the most visible and alarming signs of liver trouble and should prompt immediate medical consultation. Jaundice can occur due to several liver conditions, such as hepatitis, cirrhosis, or bile duct obstruction. It's important to pay attention to other symptoms that may accompany jaundice, like dark urine or pale stools, to get a fuller picture of your liver health. 2. Abdominal pain and swelling. The second sign is abdominal pain and swelling. This pain, especially felt in the upper right part of the abdomen where the liver is located, can be due to inflammation or enlargement of the liver. Conditions like hepatitis, fatty liver disease, and cirrhosis. In some cases, the abdomen may appear visibly swollen or distended, a condition known as ascites, which is the accumulation of fluid in the abdominal cavity due to liver disease. Abdominal pain associated with liver problems can sometimes be mistaken for other issues, such as gallstones or digestive disorders. If you experience persistent pain or swelling in this area, it's essential to seek medical advice to determine the underlying cause. 3. Dark-colored urine. The third sign is dark-colored urine. Urine is typically light yellow. However, when there is liver dysfunction, bilirubin can build up in the urine, causing it to darken. This change is often due to high levels of bilirubin in the blood, which is then excreted through the kidneys. If you notice your urine is consistently dark, especially if it's accompanied by other symptoms on this list, it's important to seek medical advice. Other causes of dark urine can include dehydration or certain medications. However, if hydration and medications are not factors, dark urine can be a key indicator of liver issues and should not be ignored. 4. Pale stool. The fourth sign is pale stool. Healthy stool is usually brown due to the presence of bile, which the liver produces. However, if the liver or bile ducts are not functioning properly, bile doesn't reach the intestines, resulting in pale or clay-colored stools. This can indicate a blockage in the bile ducts or a liver that is not producing bile effectively. Pale stool is a significant symptom that warrants a checkup with your healthcare provider. Pale stools can also be a sign of conditions like gallstones or pancreatic problems, which can similarly affect bile flow. If you notice a persistent change in stool color, it's essential to consult a healthcare professional for proper diagnosis and treatment. 5. Fatigue and weakness. The fifth sign is fatigue and weakness. The liver is crucial in metabolizing nutrients and detoxifying the blood. When it's not functioning well, toxins build up in the body, and the energy production process is disrupted. This leads to persistent fatigue and weakness, even if you're getting enough rest. If you find yourself feeling unusually tired without a clear reason, it might be time to evaluate your liver health. Fatigue related to liver disease is often chronic and doesn't improve with rest. It's important to distinguish this type of fatigue from regular tiredness, as it can significantly impact daily life and overall well-being. 6. Loss of appetite and weight loss. The sixth sign is loss of appetite and weight loss. liver diseases can interfere with the digestion and absorption of nutrients, leading to a decreased appetite and unintended weight loss. This can be a gradual process, often going unnoticed until significant weight has been lost. If you experience a sudden change in your eating habits or a notable decrease in weight, it's important to consider liver issues as a possible cause. Appetite loss and weight loss are serious symptoms that can lead to malnutrition and weakened immune function. These changes should be closely monitored and discussed with a healthcare provider to ensure proper diagnosis and management. 7. Itchy skin. The seventh sign is itchy skin. When the liver fails to properly process bile, bile salts can accumulate in the bloodstream and deposit in the skin, causing itching. This itchiness can be widespread and persistent, often without any visible rash. Itchy skin can be incredibly uncomfortable and is often an overlooked symptom of liver problems. It's important to note that itchy skin, due to liver disease, doesn't usually respond well to typical anti-itch treatments. If you have persistent itching that cannot be explained by other conditions, it's worth investigating liver function. 8. Edema, swelling in the body. The eighth sign is edema, which is swelling caused by fluid retention. This is commonly seen in the feet, ankles, and legs. The liver produces albumin, a protein that prevents fluid from leaking out of the blood vessels. When liver function is impaired, albumin levels drop, leading to fluid leakage and swelling in the tissues. Edema can be an early sign of liver disease and should not be ignored. Edema associated with liver disease is often symmetrical, affecting both legs equally. It can also occur in the abdomen, causing a condition known as ascites. Monitoring for swelling and seeking medical advice promptly can help manage and treat the underlying liver condition effectively. 9. Nausea and vomiting. The ninth and final sign is nausea and vomiting. These symptoms occur because the liver's impaired ability to detoxify the blood can lead to a buildup of toxins that affect the digestive system. Additionally, the liver's inability to produce bile properly can disrupt digestion, causing persistent nausea and vomiting. If these symptoms are ongoing and unexplained, they may be linked to liver dysfunction. Nausea and vomiting can severely impact your ability to maintain proper nutrition and hydration. Chronic digestive issues should be evaluated by a healthcare provider to rule out liver disease and other serious conditions. As you can see, there are numerous signs that may indicate liver diseases and damage. Each of these symptoms can significantly impact your quality of life and should be taken seriously. If you experience any combination of these signs, it's crucial to consult a healthcare professional without delay. Early diagnosis and treatment are vital for maintaining liver health and preventing further complications. To protect your liver health, there are several proactive steps you can take. Regular health checkups are essential for early detection of liver issues. Adopting a balanced diet rich in fruits, vegetables, and whole grains, while limiting processed foods and saturated fats, can support liver function. Additionally, moderating alcohol consumption is crucial, as excessive drinking is a leading cause of liver damage. Staying hydrated and engaging in regular physical activity can also help maintain liver health. Another important aspect is avoiding unnecessary medications or supplements that can burden the liver. Always consult with a healthcare provider before starting new medications or supplements,